This video is made for you if you are living in Germany and have questions about the prenatal care. The pregnancy journey extends for 40 weeks and is divided into 3/3, during which the doctor is visited approximately 12 times before the due date. Once every 4 weeks. Until the 32nd week, when visits become every 2 weeks. First trimester. The first visit usually occurs between the 7th and 8th weeks. This is when the pregnancy is confirmed and the most important pregnancy document, the Mutterpass, is obtained. Here, the details of the pregnancy will be documented and anticipated due date. Also, a vaginal ultrasound is performed and a blood test, blood pressure and weight, are measured. These tests are routinely repeated during this first trimester. A urinalysis is conducted once to exclude chlamydia infection and then regularly at every visit to exclude urinary tract infections and pregnancy diseases. Between the 9th and 12th weeks, a first in-depth ultrasound screening is performed to determine the age of the pregnancy, the due date, and whether there are specific hereditary conditions to take into consideration, such as Down syndrome. Also early on, up to the 10th week of pregnancy, you can undergo what's called the Harmony Parental Test. This is a non-invasive prenatal test, NIPT, uses just one vial of blood from the mother to screen for Down syndrome, trisomy 21, and 2 other rare but devastating genetic disorders, Edwards syndrome/trisomy 18 and Patau syndrome/trisomy 13. It also provides accurate information about the sex of the fetus. The cost ranges between €200 and €500 at your own expense. Finally, during this trimester of pregnancy, it's the right time to find a midwife to support you during pregnancy and after birth. The later you wait, the less your chances are of finding a good available midwife. Statutory health insurance covers a vaginal ultrasound at each visit and only covers 3 abdominal ultrasound scans, 1 in each trimester of the pregnancy. You can tell the doctor that you want an abdominal ultrasound at each visit at your own expense, and the total cost is around €130. Second trimester pregnancy tests. The second in-depth ultrasound takes place between weeks 19th and 22nd. In this examination, many parents discover the sex of the fetus. Also, an anatomical examination of the fetus's organs such as the individual chambers of the fetus's heart, the spinal cord, and brain development is performed. The doctor will be able to rule out any fetal deformities and some hereditary conditions such as spina bifida and trisomy 18 or Down syndrome. You can also ask your doctor for a 3D image of the baby. The second important test in this trimester is the gestational diabetes glucose test. Statutory health insurance covers the routine gestational diabetes test, which lasts about an hour, and you can also have a comprehensive gestational diabetes test at your own expense, which costs around €30 to €60. If gestational diabetes is confirmed, you will be referred to a diabetes clinic to monitor the condition and provide medication or even take courses for suitable nutrition for diabetes. The insurance covers the total cost. In this trimester, you should register at your hospital of choice for the delivery. Third trimester pregnancy tests. Third in-depth ultrasound between weeks 29th and 32nd to examine the digestive system in particular and ensure that it is functioning. For example, your gynecologist may notice that there is now visible fluid in the digestive tract or bladder of the fetus, which indicates that it is swallowing amniotic fluid and urinating it. The quantity of fluids surrounding your baby as well as the blood flow within the umbilical cord will also be examined. Starting from the 32nd week, doctor's visits occur every 2 weeks instead of monthly, to monitor the fetal heart by ultrasound to record its heart rate and the rate of uterine contractions of the pregnant mother by CTG scans. Also, in the 3rd trimester of pregnancy, you are expected to be asked about an optional test for Group B streptococcus. These streptococci colonize the human colon and can move to the vagina from there. For this reason, your gynecologist will take samples from both the vagina and the rectum to ensure they are not present. In essence, Group B streptococcus, GBS, bacteria are carried by approximately 25% of women. The German Society of Gynecology and Obstetrics advises those in the 35th to 37th week of pregnancy to undergo testing for this bacteria. Unfortunately, this test isn't covered by the statutory health insurance, hence, it adds to the overall pregnancy expenses. The cost of this test in Germany generally ranges from 10 to 30 euros. In case your test results come back positive, it's advised to take antibiotics during labor. This step is crucial in reducing the risk of GBS transmission to your newborn following the rupture of the mother's amniotic sac.